Hi, it's David from Bodyworks. If you're not working on jaw releases, your neck, back, and shoulder clients are actually suffering more than they need to. Those muscles really relate to everything else, and so working up in here and getting those released is going to really pay dividends for those clients. Jaw work is not just for TMJ, so let's get going. So we talked about jaw work, right? And it's easy to start thinking of everything as just these muscles here, right? But this whole set of muscles actually relates to a front fascial chain that starts at the pubic bone, comes up through rectus abdominis, through the sternal fascia, up through SCM, and around the back of the head into the mastoid process, and even there's sort of a retinaculum band around the back of the skull that actually loops one side to the other. That fascially weaves up into temporalis and down into masseter and has a lot of effect on that. So when I have a client who comes in with TMJ or direct jaw issues like migraines, headaches, or even just shoulders that never seem to drop or neck pain that just never seems to go away, I'm gonna start thinking about releasing the jaw by actually releasing up the front of the body through here, all right? And so what I'll do is undrape Christopher down to here, and we can fascially work up rectus abdominis, and I'm just gonna use 3 fingers sliding right up through the tissue. I'm not trying to push down at all. I'm skating along the surface. Rectus abdominis is a very thin muscle. You do not need to go very deep at all to be working on it. And I can bring that gently up right into the xiphoid. And you'll notice I'm doing myofascial release work, and I'm not using oil today. You certainly can use a little tiny bit, especially if the fascia or the skin's not moving. But for him, he's moving. It can feel a little bit rug burny, but it really can have a great effect all the way up into the neck and the jaw. And so you want to make sure to balance and do both sides. There we go. And what I'm hoping for is that I start to see the breath go up into the upper chest and that the sternum starts to rise and fall a little bit more. And just keep in mind, I just got to his xiphoid, which can feel pretty zingy for a client. So that looked like maybe on his face a fair amount of intensity, and that was a very light pressure. Okay, so then I start at the xiphoid, just a little bit above it to make sure I'm not putting pressure straight down on it. And I can now fascially work straight up the sternum. Again, I'm skating straight across it. I am not pushing down very much. And especially with male clients, you're gonna have to make sure that you're not pulling too fast so that you yank hair along with the stroke. And for female clients, I would actually leave them draped or use a chest drape for obvious reasons. But for me, I would even do that under the sheet and blanket, just sliding up. You want to make sure that you're just on that and you're not contacting breasts for obvious reasons. All right, so then I can re-drape just for comfort. Most clients prefer that. And now I am going to use a little bit of oil, just a touch on the pecs. And I'll slide up here. And last but not least, just make sure I've got a little tiny bit of lubrication on the SCM and the scalenes. So for pecs, one of my favorite releases I'm stealing from a guy named Cardin Rabin, one of my friends from school. This would have been 17 years ago. He came up with this and did it on me, and I was like, I'm stealing that. And apparently a decade later, he had completely forgotten about it because I did it on him and he was like, "What's that? That's cool. I want to steal that." And I was like, "Dude, I stole that from you." So basically what I'm doing is I'm sliding gently across, bringing the point of my elbow past his sternum into the belly of the pec, and then gently pulling across below the collarbone and out. And again, this is not a down deep kind of a stroke. This is getting a depth, getting into the tissue a little bit to a depth that feels good, and then skating across that plane. Okay. So we're going to do some SCM and scalene releases to help open up this tissue up into the jaw. I also show some techniques for that in a different video up there for our 5 neck techniques video. So check that out. I'm not going to show a lot of these today. I'm just going to show a couple. And the idea is we're basically opening up this whole front chain that's pulling on the head and the jaw so that when we get to the jaw muscles, they're going to be a lot easier to release and it's going to have a deeper and more meaningful effect. All right. So I'm just going to rest his head in my palm on this side. And that allows me to gently rock it back and forth without having to like tug on him or try to push his head. Basically, I'm just rocking my hand and letting his head roll in gravity. And I'm going to use the edge of my thumb to contact the inside of SCM and pull lightly laterally. And I want to start just by touching the lateral edge. I don't want to just come right into SCM from straight down because that can be a little shocking. So I'm going to come out here and touch and then work my way lightly down the collarbone until I can contact SCM on the inside and just gently pull it laterally. I want to make sure, again, I'm not going too far down into the tissue because that gets into the throat and would feel awful and potentially be dangerous. And then the rocking is providing a pin and stretch on the muscle itself. Then I'm going to come lateral to that, just above the collarbone, and feel gently for any kind of a ropey thing. That is going to be one of his scalenes, and there are many. And I'm just going to work gently laterally. This doesn't need to be a big deal. A little bit of pressure here, it feels pretty intense, and I'm just going to continue working laterally through there. And then I can switch hands, let him fall a little bit to the left, contact out here, work my way up the collarbone, hook my thumb, and gently get on the inside of his right SCM. And again, I'm gently pulling that laterally and then rocking the head to provide a nice stretch on SCM. There's plenty of other ways to work on SCM, and in fact, we have a 2-day live workshop on head, neck, jaw where you're going to learn way more interesting things, but this is a really simple and easy basic contact for these muscles that can be on its own still highly effective. Okay. There are some much more advanced releases, again, in that live workshop that we'll show. I don't really feel comfortable showing some of this stuff on YouTube to the entire world, and you definitely should be a licensed massage therapist even to do the stuff that we've already talked about. But there is a basic one here that's pretty simple, which is that in between your SCM muscles, you've got the trachea. And right above the trachea, you have the hyoid bone, which sort of looks like a set of horns. that way, right? And the sort of body of the muscle points up in this direction and the two horns come down around the outside. You can very gently, with two fingers, come in, and again, I like to contact way lateral out at the shoulder before I work my way in towards the trachea, because if you just come and touch somebody's trachea, they will freak out. So work my way laterally up into there, get the brain knowing where I'm going, and then I can very lightly, and I mean very lightly, I'm basically putting my two fingers right on the outside of his trachea and then rocking that side to side. No downward pressure at all. It's all sideways pressure. And then I can come up above the trachea and find the hyoid bone and gently rock that as well. All of this needs to be very much parallel. All of this needs to be parallel to the table. None of your pressure should be going down. It should all just be shifting side to side once you're in the right place. If you're feeling yourself put any downward pressure at all, then stop. You don't need it. The client will, it's dangerous, right? You don't, these are very delicate structures. You absolutely don't want to put any downward pressure. And I'm not squeezing my fingers either. I'm just creating a shape and then moving it side to side, and it's going to take, and you can do this on your own just to feel it first. And that might be the safest way to learn, is just to put your fingers on the outside of your own trachea and just rock back and forth. You can even do it while sitting. And then to come up above to the top of the trachea where you feel the hyoid bone, and gently rock side to side on yourself. Once you feel like what feels comfortable doing it on your own trachea and hyoid bone, it's probably going to be much easier to find it on a client and make sure that you're doing it safely. But those hyoid muscles come up through here and down through here, and that gentle rocking can just help them soften and release and feed up fascially into the jaw. And so basically we've done the front line, up, rectus abdominis, up through the sternal fascia, up through SCM, up through the hyoids, and now we can get into the jaw. And so I'm not going to show, there's 4 jaw muscles, right? There's masseter, temporalis, medial and lateral pterygoids. The pterygoids are inside the mouth. There is great intraoral work that we show in our head, neck, jaw workshop, live workshop. I'm not going to show that on YouTube. But the external muscles, the temporalis and the masseter, that's really simple and easy and can still be very effective for clients without the inner mouth work. So one of my favorite temporalis releases is to turn the head at a 45-degree angle. I'm going to take one hand and use my fingers to hold the temporalis on this side, and the palm of the other hand can just rest on temporalis, and I'm taking those and I'm going to put a little pressure and then squeeze both of them up towards the top of the head. And again, this is not a lot of pressure into the skull. With all myofascial work, you're basically finding a depth within the tissue and then sliding across that plane. Then, after I get the temporalis on this side, I can come down in for masseter. So finding the temporalis tendon up here, we can do a little cross fiber friction, and then fascially slide down masseter. With somebody like Christopher who's got a beard, you got to make sure to work slow so that you're not pulling hair. And then you can look for and find little trigger points and do some gentle cross fiber friction on them. A little bit of pressure goes a long way with these muscles. All right, and now I'm just gonna repeat that on the other side. So I'm turning his head 45 degrees, taking these fingers right above the ear on that side, and this palm right above the ear on this side. And I'm just gonna squeeze a little tiny bit and then pull that whole thing up towards the top of the head. And this one, not only does it feel great on the muscles itself, it can kind of feel like I'm turning off your brain. Which for most of us is a pretty nice feeling. And again, little, ooh, hi there. Little cross fiber friction on the tendon of temporalis, which is just above the ear, just in front of it for most people. And then I can fascially come down masseter, do a little trigger point work in it, and trust me, a little goes a long way. And come back. And I noticed that his right side was tighter than his left, and lo and behold, I can see that his jaw, like if I'm looking down the front of his skull through his eye sockets, his jaw does sit slightly off to the right, and that would, you know, line up with the idea that the muscles on that side are working a little bit harder. That's not unusual for most people. If I were seeing a client on my table, I would probably get my gloves out and do inner mouth work on the pterygoids, medial and lateral pterygoids. We're not going to show that on YouTube. I'd also potentially do some work on longus coli, which involves sliding the trachea slightly out of the way and sinking down onto it on the front of the cervical vertebra. Again, that I'm definitely not showing on YouTube. But we do show that in our live workshop. So if you're in the New York City area or travel here and are interested, that is a great 2-day workshop on all head, neck, jaw work that I do, including those releases. And you can find links to that in the description below. After doing all of that, I also like to end with a nice little frontalis release. Technically not a jaw muscle, but it can fascially weave into temporalis, and it just feels good. One of my favorites for this is just to take my 2 thumbs right on the center of his forehead like this, and just slowly spread. I'm going, again, a slight downward pressure and then skating along the bone, just to separate that, and again, turn off his brain a little bit. And last but not least, this would be a really good opportunity to end a session after all of that slightly more intense work with a gentle suboccipital hold. Even if you're not a trained craniosacral practitioner, it's easy enough just to get your fingers gently into the suboccipitals and rest his skull right on the palms, and just use a little bit of backwards traction with your whole body. Not a lot, this is not a big deal, it's just meant to be a nice finisher move. All right, great. So, there you go. There's some simple jaw releases that, again, obviously you would do for a TMJ client, but we would also highly recommend doing that for your shoulder pain clients, your neck pain clients, even your back and pain clients. Hope you liked this video. Please hit the like button and subscribe, and we hope to see you later. And if you like this video, we bet you'll like this one too.